Thank you, as always. Always there to put it in perspective. If you didn't understand it before, you understand it now. Made it plain. Now we know what we got to do. We'll be hearing more about what we got to do, but we got the big picture. Thank you, Reverend Jackson. I want to call up for greetings and remarks Kimberly Jeffries Leonard. Dr. Leonard is the Senior Deputy Director, Department of Health, Addiction, Prevention, and Recovery Administration, representing the Honorable Mayor Vincent Gray, the Mayor of the District of Columbia. All right, while she's making her way, we ready for action? Yes, sir. All right. I told you we're going to get some advocates together, and we're going to go out in all the communities. We got a petition, and we got a plan to change this public policy. We're going to do it. These are the seeds. Dr. Leonard.
Thank you so much. Good afternoon. Good
afternoon.
First of all, Dr. Daniels, board members, distinguished panelists, the Honorable John Conyers, Representative Scott, Reverend Jackson, and invited guests, on behalf of Mayor Vincent Gray, it is my honor to welcome you here in the District of Columbia and to bring this conference to the District of Columbia. On behalf of Mayor Gray, we'd like to thank Dr. Daniels and the Institute of the Black World of the 21st Century for bringing attention to this issue right here, right now. Yeah. The impact of drug use, whether it is in the District of Columbia, Detroit, Michigan, Newport News, Virginia, or Durham, North Carolina, can be devastating to a black person, family, or community. We know that we have to address this from a treatment model, from a prevention model. So when we look back at 40 years ago and we look forward, we say, where are we now? How far have we come? Our findings to date at the Department of Health show that drug use still has a powerful influence over the destinies of too many citizens of the District of Columbia. For example, we know that when drug use interacts with poverty, the synergy can be life-altering. When substance abuse is experienced during adolescence, the trajectory of young lives is altered. In places that young people find themselves, they are a serious risk for incarceration, poor educational attainment, lower income potentials, and can cause extreme negative impacts on black family life. Substance abuse, including use and dependence, is the single most important factor of HIV/AIDS transmission in the District of Columbia, and you know we have a serious issue there. Prevention of initial use, early intervention in pre-dependent use, and treatment of dependence and addiction are DC's primary avenues to addressing this epidemic. We want to prevent and treat and not react in order to eradicate this issue. When we look at the issues that we're dealing with, this is a priority of Mayor Gray's, and he has a threefold approach to addressing this critical issue. We're developing and implementing a patient-centered approach to treatment, which will coordinate substance abuse with primary care, HIV/AIDS, within the Department of Health. We're developing relationships and partnerships, both internal to the government and external, so that we can guide prevention and treatment methodologies so that we know that this is not something to look at from an incarceration perspective, but from a treatment perspective. We want to synergistically serve those residents who are touched by drug abuse. We're developing and implementing community-based approaches to prevention that start in our community. This allows us to listen and identify what our community feels it needs and to be able to assess and enhance the approaches that we're already using. We're waging our own war on drugs here in the District of Columbia, but with key partnerships such as this one, working with organizations, working with you, we plan to win this war from a proactive approach and not from a reactive approach. On behalf of Mayor Gray, again, I welcome you and thank you for letting us be a part of this important issue today. Thank you.
And please, Dr. Leonard, tell Mayor Gray that we're looking forward to working with him on these efforts. We have a strong component here in the district, and this is one of the key areas we think we need to be involved in and will be involved in. Next, I want to call up for greetings and remarks a sister that, I mean, words fail me. Every time I see a presentation, I just say, that's a bad sister. I mean, you know what I'm talking about. She is the stuff. Dr. Elsie Scott is president of the Congressional Black Caucus Foundation, Inc., and every time she speaks, I get my pen out to take notes. So I suggest you get your pens ready, put your hands together for Dr. Elsie Scott.
You know, you hate to get an introduction like that, then people are expecting so much. I was just thinking that, why did they put me after Reverend Jesse? What can I say? Let me just first thank Ron Daniels, who has never strayed from the cause. Ever since I met him, he's been on the front line, and he's never moved away from it, and he's always tried to keep all of us centered with what we need to do. And I'd also want to recognize Sister Nkechi, I saw coming here, who's really been on the front line in fighting to get rid of unjust sentencing. When I started looking at, you know, this 40-year war on drugs, and I just started pulling out some of the, take you back to think about some of the things that the U.S. has done in the last 40 years, the so-called war on drugs. It was in June 1971, Richard Nixon declared war on drugs because drug abuse was the #1 public enemy. 1973, Nixon created the DEA. In 1976, something you don't hear much about, former governor of Georgia, Jimmy Carter, who was running for president, campaigned on a platform to decriminalize marijuana. You don't hear a lot about that, do you? And end the federal penalties for possession of up to 1 ounce of the drug. In 1981, we had the rise of the Medellin drug cartel. And then we started with our war against Panama, Noriega. In 1984, all of us remember this, Nancy Reagan launched our Just Say No. She thought it was as simple as that. In 1986, Reagan signed the Anti-Drug Abuse Act of 1986, which put in $1.7 billion to fight the war on drugs. In 1989, we had the creation of the so-called Drug Czar's Office. In 1989, the U.S. invaded Panama to arrest General Noriega. In 1993, President Clinton signed the North American Free Trade Agreement, which increased the amount of trade and traffic across the U.S.-Mexican border. And this made it more difficult for customs to find narcotics moving across the border. In 1995, we have the U.S. Sentencing Commission releasing a report that acknowledged that there was a disparity in sentencing crack versus powder cocaine. And so we could go on and on, but those are some of the things I just wanted. Sometimes we forget, say, what happened over these 40 years? And now we're here today, and what have we accomplished? Reverend Jackson talked about how it has been a war on African Americans and brown people, because if we look at the prison statistics, we see that many blacks, and Reverend Jackson gave you some of the figures in terms of the disproportionality of blacks in prison as it relates to drug offenses. But let me just talk a little bit about the cost, and then I'm going to sit down because I want to hear all these great speakers we have here. The cost of incarceration as it relates to drugs. The average cost per state prisoner per day in the U.S., this was in 2007, so it's higher than that now, was $67.55. State prisons at that time held 253,300 inmates. for drug offenses. This meant that states were spending $17 million, over $17 million per day to imprison drug offenders. So it's been hitting this country in the pocketbook as we look at why we're having a budget crisis here. A study by the Washington State Institute for Public Policy found that for every dollar spent on drug treatment, this is where we could be spending money, spent on drug treatment in the community, it yields over $18 in cost savings related to crime. In comparison, that if we spent that money on prisons, it would only yield 37 cents in public safety benefits. So if we release more people to supervision, made treatment more accessible, then we might have a way of reducing drug use and reducing crime and reducing the federal budget. So just in closing, I was talking with Congressman Bobby Scott, and I think he's going to be here later the other day, and we're working on a book at the CBC Foundation on the 40 years of the CBC. And I'm writing a chapter on criminal justice.
Right.
And I asked Congressman Scott, what did he consider to be the accomplishments of the CBC